where we talk about salient issues pertaining to our health. And today is not an exception. So today we are looking at something that has been disturbing the men folk more importantly for about decades now. And of course, this issue has generated some kind of controversies among couples, about the causes and all that. But we'll get to know the real causes of these issues this morning, and today we are looking at cancer of the prostate, the leading cancer in men. Yes, more oftentimes we come here, we talk about issues pertaining to women and all that. So it's the men's world today. We are talking about the men folk this morning. So cancer of the prostate, the leading cancer in men, is that we're looking at it. And we have a man who knows his onions very well. Of course, a round peg in a round hole, definitely. He's a consultant urologist, Federal Medical Center, or Dr. Bakare Nurudeem. Glad to have you join us on the program this morning, sir.
Yeah, good morning, our listeners. Good morning, our Uncle. Thank you very much.
All right, without much ado, ẹ káàbọ̀ sórí ètò wa. Ètò Mixed Grill, ètò wa ètò yín ìlera lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association ìyẹn ti ìpínlẹ̀ Ondo ń bí. Lónìí, a máa mẹ́nuba ọ̀rọ̀ ìlera wa kan. Ní gbogbo gbà pàápàá jùlọ, a máa sọ̀rọ̀ nípa àwọn obìnrin, nǹkan tó ń ṣe àtọkùnrin àtobìnrin nígbà mìíràn àrò obìnrin. Àmọ́ lónìí àwọn ọkùnrin la fẹ́ sọ̀rọ̀ lé lórí lónìí. Nǹkan tó dẹ̀ ta dẹ̀ fẹ́ mẹ́nubà lónìí ó ti fa wàhálà láàrin tọkọtaya dé pé àwọn kan ní lọ́jọ́ iwájú òun ò fẹ́ nírú nǹkan báyìí nǹkan kan bẹ́ẹ̀ á máa jẹ́ kí àwọn ọkùnrin kankan kó dàbí pé wọ́n fẹ́ ṣìwàwò ń gbà mìíràn pé torí nǹkan báyìí ni mo ṣe ń ṣe àwọn nǹkan báyìí tó bá ti lè ṣe nǹkan báyìí kó fi sílẹ̀ nǹkan kan bẹ́ẹ̀ yẹn. Àwọn ìyẹn náà àwọn controversies wọ̀nyí àti nǹkan tó ń fà á gangan òun náà ni dókítà máa bá wa yànnàná lónìí. Adé ti ní dókítà tó dáńtọ́ dáadáa, dókítà tó mọ̀ye. Àwọn náà ni consultant urologist Federal Medical Center tìlú Ọ̀wọ̀, dókítà Bakare Nurudeem. Ẹ ṣeun gan tá a pè yín tẹ̀lé jẹ́ wa lórí ètò lónìí.
Ẹ ṣeun gan olóòtú, a kí àwọn olùgbọ́ wa ẹ káàárọ̀, ẹ kí gbogbo lé.
Ẹ ṣeun gan ni. Producer wa náà wà nílé agbára ń bi dókítà Ọ̀pẹ́yẹmí Kọ́mọláfẹ́. Àwọn náà ló ń rí pé gbogbo ètò yìí ń wá sétí ìgbọ̀nyín lákòókò tó yẹ. Àwọn ló ń wá bọ́ ṣe máa rí àwọn dókítà tó mọ̀ye tá à ń sọ̀rọ̀ nípa ẹ̀ tó máa wá sórí atẹ́gùn láti wá bá wa yànnàná ọ̀rọ̀ yìí. Orúkọ tèmi ni Comfort Ọmọláfẹ́. Láì fi àkókò ṣòfò, jẹ́ ká bẹ̀rẹ̀ lédè abínibí wa nítorí ìjọba àkókò. Dókítà, kí ni wọ́n ń pè ní prostate? Gangan or kó tó di pa wá sọ cancer of the prostate. Kí ni nǹkan tí what can you define? Mo fẹ́ kẹ́ sọ bóyá ká dẹ̀ máa ṣe báyìí ká máa ṣe ní mixed grill. Ìfìtẹ́ bá lè kó mix ẹ̀ papọ̀. Báwo lẹ ṣe lè ṣàlàyé prostate fún wa kó tó di pé tẹ́ bá ti wá ṣàlàyé tẹ̀ wọ́n á bá mẹ́nuba cancer of the prostate.
Ẹ ṣeun gan ni. Nǹkan tá a mọ̀ sí prostate. Prostate jẹ́ ara ẹ̀yà ara tó jẹ́ pé àyè ibi tó wà, ibi tí ó ní í ṣe pẹ̀lú ètò ọmọ bíbí níbi ìsàlẹ̀ ni ló wà. So àwọn ẹ̀yà ara wà tó jẹ́ gbòógì ni nípa ètò ọmọ bíbí. So prostate ó wá jẹ́ bí alásọ̀gbè bí we call them as they are like accessory reproductive organ tó jẹ́ pé ó ní nǹkan tí wọ́n ń ṣe. Iṣẹ́ tó ń ṣe gangan ni pé tí àtọ̀ bá fẹ́ jáde lára ọmọkùnrin láti bí kóró ẹpọ̀n ní àtọ̀ tí ń wá, ṣùgbọ́n kò lè dá rìn fúnra ẹ̀, ó nídìí omi àti nourishment kó tó di pé ó dé ara obìnrin, kó tó di pé ẹyin bá pàdé kó tó dọmọ. So prostate yìí ló máa ń produce omi lára omi bí 30% omi tí àtọ̀ máa ń lò láti fi rìn. So prostate yìí ló máa ń produce ẹ̀ àti nourishment tó náà máa ń produce ó wà fún àtọ̀ láti fi live fún bí like 7 days kó tó di pé ó kú tí ò bá rí ẹyin láti ṣe jọ papọ̀ kó fi dọmọ. So iṣẹ́ tí prostate ń ṣe lára nìyẹn. Ààyè ibi tó wà lára òun ni pé níbi abẹ́ ibi gbẹ̀du ibi títọ̀ máa ń kóra jọ sí tá a mọ̀ sí bladder, abẹ́ ẹ̀bẹ̀ ló wà. Ṣé rí wá rí ọ̀pá tó gbé ìtọ̀ jáde lára ọkùnrin, àárín ẹ̀ ló gbà kọjá, àárín prostate yìí òun ló gbà kọjá. So ìdí nìyẹn tó jẹ́ pé tí èèyàn bá ti ń dàgbà ni prostate náà máa ń tóbi díẹ̀díẹ̀ sí. So ìgbà tá a wà ní kékeré tá a bá tò lẹ́gbẹ̀ẹ́ ibì kan tí gbogbo àtàlà ń tọ̀ a máa lè tọ̀ tí jẹ́ pé ìtọ̀ wa lè gùn gan, a lè lọ síwájú dáadáa. Ṣùgbọ́n tí èèyàn bá ti ń dàgbà tó dé stage kan ìtọ̀ yẹn ò ní lè lọ sọ́ọ̀kan bó ṣe máa ń lọ tẹ́lẹ̀. So prostate ló máa ń fà á nítorí pé ó ti ń fún ọ̀pá tó gbé ìtọ̀ jáde lára àgbẹ̀dù ilé ìtọ̀ yẹn so nǹkan tí a mọ̀ sí tí ó ń jẹ́ prostate yẹn iṣẹ́ tó dẹ̀ ń ṣe nìyẹn ṣùgbọ́n tíyàn bá ti ń dàgbà ó máa ń tóbi díẹ̀díẹ̀ sí.
ẹ ṣeun gan ni kí wàá ní cancer of the prostate.
ẹ ṣeun gan ni.
ìyẹn jẹjẹrẹ.
jẹjẹrẹ generally kò sí ẹ̀yà ara tí jẹjẹrẹ ò lè bá ìdí tán dẹ̀ fi pè ní jẹjẹrẹ ni pé ó máa ń ṣòro sí ara ó lè lọ sọ́pọlọ ó lè lọ sí eegun ó lè lọ sẹ́yìn ó lè lọ sínú ẹ̀dọ̀ ó lè lọ sínú ẹ̀dọ̀fùkù tá a mọ̀ sí lungs so ìdí tán fi ń pè ní cancer nìyẹn ṣùgbọ́n ti prostate ó wá jẹ́ lè tó jẹ́ pé ó lè ṣẹlẹ̀ sí prostate náà so tó bá ṣẹlẹ̀ òun náà gbogbo iṣẹ́ yìí ló lè ṣe àyè ibi tó wá wà yẹn ó súnmọ́ oríṣiríṣi nǹkan tó pọ̀ ó súnmọ́ ilé ìyàgbẹ́ ó súnmọ́ bladder ọ̀pá tó gbé tọ̀ wá láti ibi kidney ibi ẹ̀gbẹ́ ibi òkè ẹ̀ ló gbà jáde so tí cancer bá mú prostate yìí gbogbo àwọn nǹkan wọ̀nyí ló lè ṣàkóbá fún yàtọ̀ sí pé òun fúnra ẹ̀ gan lè ṣe oró sí gbogbo ara ó tún lè ṣàkóbá fún gbogbo ẹ̀yà tó yíká so tí jẹjẹrẹ bá mú prostate yìí ara àwọn nǹkan tó lè ṣẹlẹ̀ náà nìyẹn yàtọ̀ sí pé kó dí ọ̀nà ilé ìtọ̀ kéèyàn má lè tọ̀ dáadáa bó ṣe ń tọ̀ tẹ́lẹ̀ ó tún lè ṣe oró sí gbogbo àwọn ibi tá a ti dárúkọ yìí yálà ó jìnnà ni àbó súnmọ́ so tí eléyìí bá wá ṣẹlẹ̀ òun náà là ń pè ní prostate cancer.
ẹ ṣeun gan ni dókítà Bakare Nurudeem àti kọ́kọ́ ṣíde ètò pẹ̀lú èdè abínibí wa ẹ já lọ sí èdè Gẹ̀ẹ́sì báyìí. Dr. Bakare, I would like you to please tell us briefly what the cancer of
about 30% of this fluid produced by the prostate is used by the sperm to move to the female counterpart. So where it is meet with the egg, so or ovum to fertilize and become a baby. However, this prostate too is as we grow up, it enlarges because the pipe that carries urine from the bladder crosses through the prostate. So thereby, when we were young, we can urinate, we can shoot our urine very far. However, as we grow up, this prostate gets enlarged. So it compresses this pipe that carries, which is called urethra. It compresses this urethra, and it becomes more difficult for urine to come out freely, like when we were young. So this is exactly what the process is and what it does and what can happen as we grow up.
How about the cancer of the prostate?
Yeah, thank you. So cancer, as we know, cancer can affect any part of the body. The reason why it is called cancer is because it can grow independently and it produces certain toxic materials that can affect the function of several organs in the body, including the brain, the lungs, the liver, the bones, our urinary system. So prostate cancer can also affect the prostate. So based on this, that is why it is very important that to look out for it. So if it happens, prostate cancer will disturb locally because the pipe that carries urine from the body crosses through it. It will disturb the urinary flow and also affect the organ that surrounds it. And because it's a cancer, it can also affect the distant organs like the one I mentioned, so causing problems and disturbing the value of life.
Thank you very much, Doctor. I'd also like you to, before we move on to our mother tongue, I'd like you to please explain if the prostate cancer is same as enlargement that we commonly talk about, obstructive flow of urine in the elderly.
Thank you very much. As I said, prostate, as we grow, gets enlarged. However, it's different from prostate cancer. These two may coexist together. They may coexist independently, in the sense that prostate, there may be enlargement without cancer. And also, there may be cancer without enlargement. The two can also coexist together. So enlargement is just like we are using it. As we grow, it's also growing as part of our body. That is enlargement. The only problem is that the pipe that carries urine from the bladder crosses through it. So that's the problem. So there may be urinary symptoms, but it's not necessarily caused by cancer. So however, if cancer does occur, that's cancer on its own. So but the two can coexist.
All right. Thank you very much, Doctor. Ẹ jẹ́ lọ síde abínibí wa. Kí ni àwọn nǹkan tó ń fa prostate cancer ní àyíká wa gan-an?
Ẹ ṣeun gan ni olóòtú. Prostate cancer ó jẹ́ cancer tó jẹ́ pé ó wà age related, that's number one. Ó ní í ṣe pẹ̀lú bí a ṣe ń dàgbà, because bí èèyàn bá ṣe ń dàgbà ní chance pé cancer lè ṣẹlẹ̀ ńbẹ̀ ló ṣe máa ń pọ̀ sí. Alákọ̀ọ́kọ́ nìyẹn tí màá kọ́kọ́ sọ. So ó wà age related. Ẹlẹ́ẹ̀kejì wa ni pé ó tún wá ní í ṣe pẹ̀lú irú èèyàn tí irú ethnicity ẹ̀yà tíyàn ti wá. Ìgbádìí ti gbé jáde pé black a máa ní irúfẹ́ ilé tó burú jù tó lágbára jù. Black American, blacks generally African of descent African tó jẹ́ pé ẹ̀yà Africa ni wá. Ẹlẹ́kẹta ni pé familiar, ó tún wà familiar tàbí pé ó lè ràn nínú family.
Hereditary.
Bẹ́ẹ̀ni. So ní lẹ́yìn àwọn nǹkan mẹ́ta tí mo ti dárúkọ ó ti wá láwọn oríṣiríṣi nǹkan tí wọ́n ti wá ti ṣàlàyé wípé ó súnmọ́ kó jẹ́ pé wọ́n ti research ti gbé jáde pé a ti lè associate ẹ̀ pẹ̀lú ẹ̀ fún bí àpèjúwe ìgbà tó ń wo ti Africa pé ó ṣe wá jẹ́ pé tiwa ló máa ó lágbára láàrin wa ju àwọn ẹ̀yà míì. Wọ́n á wò pé bóyá oúnjẹ tá à ń jẹ pé a máa ń jẹ ẹran ìgbẹ́ gan, a máa ń jẹ ẹran àwọn animal gan, a máa ń jẹ àwọn oúnjẹ tó heavy gan. So bí ẹ lè ṣàlàyé reason tó yẹ pé prostate tiwa máa ń fi tóbi ju ti ẹ̀yà míì. So wọ́n á wò pé ṣé lè fà. Then àwọn nǹkan míì wà tó jẹ́ pé wọ́n á wo àwọn ẹ̀yà kan tó jẹ́ pé wọ́n like máa jẹ ewébẹ̀ gan, máa jẹ ẹja, wọn kì í sábà ní compare sí àwa tó jẹ́ pé àwọn bí ẹran ìgbẹ́, ẹran animal, gbogbo nǹkan tó ní í ṣe pẹ̀lú animal la jẹ jù. So ṣé lè wá ṣàlàyé pé ìdí tí àwọn ilé òfin ní compare sáwa tó jẹ́ pé nǹkan táwa máa ń jẹ jù bí ẹran, bí nǹkan tó bá ṣáà relate mọ́ animal, táwa fẹ́ jẹ fat ni o, a fẹ́ lo oil ni o, a fẹ́ lo ẹ̀jẹ̀ ẹran ni o, a fẹ́ animal ṣáà ni àti àwọn oúnjẹ tó heavy. Ṣé eléyìí wọ́n lè ṣàlàyé ẹ̀ compare sáwọn irú àwọn Bangladesh, àwọn bí Chinese, àwọn tó jẹ́ pé wọ́n jẹ ewé ju
ẹran lọ,
ẹja jẹ. So wọ́n á wò pé bóyá dietary modification tiwa ó yàtọ̀ sí tiwọn. Ṣé lè ṣàlàyé tó jẹ́ pé ó jẹ́ kí prostate wa máa tóbi ju tiwọn lọ tó jẹ́ pé at the end of the day ó lè jẹ́ kí cancer pọ̀ láàrin wa àti irúfẹ́ cancer tí ó jẹ́ pé ó máa ń ṣẹlẹ̀ ní among the black ṣé ó lè cause ẹ̀. Then àwọn kankan wà tó jẹ́ pé wọ́n tún wá sọ pé ìgbésí ayé táwọn ń lò náà ó lè jẹ́ kó máa fa pé kí cancer máa pọ̀ sí láwùjọ wa lénìí. Bíi pé ṣe exercise mọ́ bí ti tẹ́lẹ̀, ní ètò ìlera wa ó ti mẹ́ẹ̀. So tomati ẹ fẹ́ dictate cancer early kò ṣeé dictate. So àti kí ó difficult. So ìgbà tó bá máa ṣẹlẹ̀ á wá jẹ́ kí ó dàbí pé kíní ẹ pọ̀ sí gan. Ṣùgbọ́n ètò tó yẹ kó wà láti fi prevent eléyìí tó burú jù yẹn kò sí nílẹ̀. So ìgbà tí wàhálà rẹ̀ bá dé á wá dàbí pé kíní ti wá pọ̀ o nítorí pé kò sétò ńlẹ̀ gan náà tẹ́lẹ̀. So láti fi bójútó pé ìgbà tó yá sì mọ́ ní kékeré kán ti bá tọ́jú ẹ̀, kán ti bá ṣe so that kò ní rí gbogbo wàhálà tó lè ṣẹlẹ̀. So ìgbà tí wàhálà yẹn bá ṣe dé náà ó ṣẹlẹ̀ sí lágbájá, ó ṣẹlẹ̀ sí táwọn ọ̀dọ́, ó ṣẹlẹ̀ sí làkàṣègbè nítorí pé kò sétò ńlẹ̀ tẹ́lẹ̀ láti fi bójútó dènà àwọn kíní. So àwọn nǹkan wọ̀nyí ló papọ̀ tá a fi lè sọ pé àwọn nǹkan tó ń fa ni. But olórí ẹ̀ ni pé àwọn bíi oúnjẹ, ètò ìgbésí ayé wa àtàwọn nǹkan míì bíi chemical tẹ́ pé a ti use mọ́ ń sìn ṣe pé àwùjọ wa kò sẹ́ni tó ń bójútó irú chemical tá à ń lò. So ọ̀pọ̀lọpọ̀ ló ń fi lẹ́sìn tó yẹ pé kò sí àwọn tó ń bójútó pé kí ni chemical tó ń lò tó fi ń fi àwọn oko tó surround ẹ̀. Kànga tá a dẹ̀ ń lò ẹ̀gbẹ́ wa ló wà. Tó yẹ pé most of the time àwọn chemical yìí wọn kì í tán nílẹ̀, gbogbo ẹ̀ náà ló máa wọnú ilẹ̀ lọ tó yẹ pé omi tá à ń mu yẹn náà ló tún máa lọ sí. So àwọn chemical ti pọ̀. So a máa gbọ́ ẹlòmíín fi chemical ṣe oúnjẹ gan tá à ń jẹ. Kò wá sẹ́ni tó ń ṣẹ́ pé kíni but góòlù tiẹ̀ ni pé kóun ṣáà ti lo chemical yìí kó fi àṣìfò. But nǹkan tí chemical yìí ń cause kò sí ẹni tó ń bójútó like that láwùjọ. So à ń lo ọ̀pọ̀lọpọ̀ chemical tó pọ̀ ilé tó ṣe kí níbẹ̀ àtúnṣe àlàyé tó wá lórí pé ṣé lè tún lè ṣàlàyé reason tó wá fi ń pọ̀ sí láwùjọ wa lénìí. So pẹ̀lú àwọn irúfẹ́ nǹkan míì ṣùgbọ́n wọ́n tún ṣàlàyé àwọn nǹkan míì tó yẹ pé ó máa ń bẹ́ẹ̀ tábà tí ìbéèrè bá débẹ̀ pé àwọn nǹkan tó jẹ́ pé ó lè fi àwọn oúnjẹ tó jẹ́ pé wọ́n ti ṣàlàyé pé ó máa ń protective against.
Ẹ ṣeun gan ni dókítà kódà ẹ ti yànnàná ẹ̀ dáadáa ẹ já lọ síde Gẹ̀ẹ́sì báyìí. Doctor, I would like to ask you, you've done much explanation in our mother tongue about the current burden of prostate cancer in the environment. So I would like you to reiterate it in English. What is the current burden or causes of prostate cancer in our environment?
Yeah, thank you very much. Prostate cancer now is the most diagnosed cancer among men. is the most diagnosed cancer among men, and is the second leading cause of cancer-related death among men. In fact, studies have shown that among the blacks, that if you gather 6 blacks at the age of 60, at least 4 of them will likely have prostate cancer. So
out of 100?
Out of, at the 60% out of 100 at the age of 60.
Okay.
So there's likelihood of...
I want to be very sure about the data. That's why I need to ask again.
So 1 in 6 of blacks will die of prostate cancer in their lifetime. Wow. 1 out of 6. So it's significant, and the burden is there. So on the family, the social burden, financial burden, disturbs the work environment. People that are not supposed to die, you understand, when you reach the age you are supposed to reap what you have been working for, it's 6 decades of life, advanced prostate cancer. So these are the things. The body is there, and the it's common is in our environment. But I don't want to say the good thing about it is that it's not everybody with prostate cancer will die of prostate cancer.
Okay.
There are some cancer that prostate cancer. In fact, studies have shown that about only 20% of people diagnosed with prostate cancer will die from it.
Okay.
But my findings
I think that's better.
Exactly.
Enough. Okay.
So, but the only thing is that, when people are diagnosed with prostate cancer, they say cancer. So people overlook some other things like the cardiovascular disease, diabetes, all other things that can kill faster than the cancer. So people die more of those things than the prostate cancer itself. So that is why it's always good to look at it from that angle, that it can be deadly, but people can live with it.
Okay, thank you very much. It can be deadly, but people can live with it. Thank you. And that moves us to this particular question. Of course, what are the early symptoms before we move to the myths and the fables about the cause of prostate cancer? What are the early symptoms and signs to look at for prostate cancer? And you did mention 60. Is it until a man gets to 60? A man from 30, because we've been told generally from 35 upward, you need to start checking on your health. So when should men start? What age should a man start checking up on himself, especially general health, and more importantly, check if he has the tendency of having a prostate cancer? And then the early signs and symptoms that people just overlook, like it is normal thing. Oh, maybe because I took plenty of fluid and all that yesterday, or once in a while. I want you to please explain in detail.
Yeah, thank you very much. I just want to start by saying that we should understand that when cancer are caught early, it can be cured. There are treatment options now that you can cure it.
That's a good one.
Now, the question is that for early symptoms, when it is seen early, what should be looked out for are mainly urinary symptoms. Mainly urinary symptoms. But it may not everybody will have these symptoms. What are the symptoms? When you wake up, you are not supposed to wake up in the night to urinate. But sometimes...
At all?
Yes.
Throughout the night?
Yes. But sometimes, depending on the food we eat, the amount of water we take in the night before we sleep, sometimes we can wake up but the acceptable number is less than 2 or less. But when it's more than 3 or more times, and it's persistent, we are not diabetic, and as a man, I think it's better to be worried about it. So that is why...
Worried about it at what age? No particular age in order?
Generally, for a man, when you notice that you are waking up...
Even in your 20s?
Yes. No, I'm not talking of cancer now.
Okay. I know exactly signs.
Yes.
Okay.
Yes. But for prostate cancer...
No, for men, I want you to begin from there. We'll take it one step at a time. Men generally, let's say you're in your 20s or in your 30s or 40s, when you begin to see that you urinate more often, you should go check.
You'll be concerned, yes.
Okay.
3 or
go
more.
ahead. Okay,
yeah.
from there. Okay.
Yeah. For prostate cancer, age of screening starts from, we use 45.
45.
For people with family history. What do I mean by family history? If you have your first degree relative, father, brother, that has 2 or more of them that has cancer, documented, you should start checking start screening by age of 45. But if it's very strong, maybe second degree relative to is adding to it, first degree, second degree relative, I think age of 40 will be advisable. But now, for people without family history, we say 50. From the age of 50, we should start screening for prostate cancer. So what do you look out for? I mentioned waking up more than 3 times, 3 or more in the night. When the urine does not come out freely, what do I mean? You get to the urina, it doesn't come out, you have to wait. That's what we call hesitancy in our own language. So if you have to wait before you start the urine, that is a symptom. You should be worried, and it's persistent. If you notice that if you are supposed to urinate at once as a man, freely, without stopping, but if you urinate and it's stopping, you have to start again like that, and it's persistent, you have to be concerned with that. Then also, if at the end of the day you have urinated and you are still having the feeling that I have not completely emptied this bladder, that is a concern. All these, there are more of it. So when we have this, these are early signs of prostate cancer, in which ordinary enlargement can also present this way. However, we don't usually advise for that, but want to wait to the time the symptoms I will be mentioning now. By the time you are having low back pain, weight loss, loss of appetite, weakness of the legs, and fatigue, generalized body weakness is not a good sign at all. Because these are signs of advance, in which by the time you come to the hospital, doctors, specialists may likely tell you that it's no more curable. So that is why screening, we'll still get there. So basically that's what we... So the symptoms are in 2 parts. Early signs for localized disease, then signs for advanced disease.
Thank you very much, Dr. Bakare. In case you're just joining us, this is Glow Health Talk with Nigerian Medical Association Ondo State Chapter. This program is co-sponsored. Ọdún nìyàn lè ṣe àti pé kí ni àwọn nǹkan tíyàn lè rí táwọn sáyẹ̀nsì wọ̀nyí nínú ọkùnrin tíyàn lè mọ̀ pé ìbájọ́ obìnrin gan ló lè rí gan ọkùnrin míì gan ó lè jẹ́yàn lọ́mọ tó ti pé 20 years tó ti pé 12 mọ̀ àbí 18 tí ò ti ẹ̀ mọ̀ nǹkan kan àmọ́ àwọn òbí tó wà láyìíká gẹ́gẹ́ bí òbí lè jẹ́ bàbá tàbí màmá tàbí ọ̀nkú gan àbí àǹtí tí wọ́n rí pé ọmọ yìí ó yẹ kó ṣàyẹ̀wò bóyá nǹkan kí ni àwọn nǹkan àpẹẹrẹ tíyàn lè rí àti pé ọmọ ọdún mélòó gan ló yẹ kó ti bẹ̀rẹ̀.
Ẹ ṣé gan ni olóòtú. Fún kí n bẹ̀rẹ̀ pẹ̀lú pé nípa ti ìtọ̀, because nǹkan tó máa ń show pé ojú ọ̀nà yẹn ò clear dáadáa òun náà ní ìtọ̀. Symptoms nǹkan tíyàn máa ń rí nípa pé bọ́kùnrin ṣe ń tọ̀ sí. So mo sọ ibi tó ti bẹ̀rẹ̀, lára àwọn ibi tó ti máa ń bẹ̀rẹ̀ ni pé tíyàn bá ti ń jítọ̀ fún bí àpèjúwe lóru, tó bá ti ju ẹ̀ẹ̀mejì lọ. So mo sọ tẹ́lẹ̀ pé kò yẹ kíyàn máa jítọ̀ lóru normally. Ṣùgbọ́n ìgbà míì wà tó jẹ́ pé bí a ṣe mu omi sí nígbà tá a fẹ́ sùn lálẹ́ àbí irúfẹ́ oúnjẹ tá a jẹ, ó lè fà á kíyàn fẹ́ jítọ̀ bí ẹ̀ẹ̀kan bí ẹ̀ẹ̀mejì. Ṣùgbọ́n tó bá ti ń ju ẹ̀ẹ̀mẹ́ta lọ tó dẹ̀ wá lemọ́ bẹ́ẹ̀, so ó yẹ kíyàn kíyèsí pé ẹ jẹ́ kíní ti ń di lemọ́lemọ́. Especially eléyìí tó bá ti ń disturb oorun èèyàn, tí ò jẹ́ kíyàn sùn, kíyàn ti mọ̀ pé òun jí lẹ́ẹ̀mẹ́rin tí ò dẹ̀ rí bẹ́ẹ̀ tẹ́lẹ̀. Ó yẹ kíyàn ti kíyèsí pé kíní ẹ jẹ́ kí n ṣe wádìí síwájú sí. Sọ pé ó lè jẹ́ cancer àkànṣọ, but tó bá ti di bí ti prostate cancer, ọjọ́ orí tó dáa kíyàn bẹ̀rẹ̀ sí ní wò pé ṣé cancer lè wà bí kò lè sí, kíyàn bẹ̀rẹ̀ sí ní ṣèwádìí nípa òun ní ọmọ ogójì ọdún ó lé 5. So fún ẹni tó bá jẹ́ pé nínú family wọn, ìdílé tó jẹ́ pé bàbá àbí ẹ̀gbọ́n àbí àbúrò ó ti ní cancer rí tó wà documented, àbí ẹni tó jẹ́ pé nínú family yẹn gan ìbá jẹ́ obìnrin tó jẹ́ pé wọ́n ní breast cancer, family history breast cancer, irú ọkùnrin inú ilé bẹ́ẹ̀ òun náà ti gbọ́dọ̀ máa bẹ̀rẹ̀ sí í ṣe àyẹ̀wò láti bí ọmọ ogójì ọdún ó lé 5, torí pé family yẹn wọ́n ní àwọn gene tó jẹ́ pé cancer lè ṣẹlẹ̀ sí, ó lè jẹ́ kí cancer ṣẹlẹ̀. Àwọn nǹkan míì tó jẹ́ pé ó tún dáa kíyàn bójútó nípa ọ̀rọ̀ prostate cancer, mo wá sọ pé cancer prostate ó pín sọ́nà méjì, pé ó lè jẹ́ eléyìí tó jẹ́ pé kò tíì lọ síbòmíì, inú prostate yẹn ni cancer yẹn wà. Ó tún lè jẹ́ eléyìí tó jẹ́ pé ó ti kọjá síbòmíì. Eléyìí tá a fẹ́ kó ṣe kíyàn lè mú, nítorí pé gbogbo cancer tá a bá mú nígbà tó ṣì wà ní ààyè ibi tó wà yẹn, gbogbo ẹ̀ ló ṣe pakú pátápátá tá a mọ̀ sí cure. ṣùgbọ́n tó bá ti lè kọjá síbòmíì, nítorí pé ibi tó kọjá sí yẹn ó ti kò lè kódà bí èèyàn mú ibi tó ti kúrò yẹn kéèyàn mú kúrò, ibi tó lọ sí yẹn á tún máa dá ṣe iṣẹ́ kánsà níbi àyè ibi tó wà ní. Kò sọ pé a ti mú sọ́ọ̀sì ẹ̀ kúrò kó wá nù, nǹkan tó fi ń pè ní kánsà náà nìyẹn. So ìdí nìyẹn tó jẹ́ pé ìgbà tó sì mọ́ ní kékeré ní àyè ibi tó wà yẹn tí ò ti kúrò ń bẹ̀, ìgbà tó yẹ ká dictate nìyẹn láti fi lè pa kú pátápátá. So àwọn nǹkan tá a máa rí tó yẹ pé nígbà tó bá sì wà láàyè òun náà ni pé mo ti sọ tíyàn máa jítọ̀ bí ẹ̀mẹ́ta jù bẹ́ẹ̀ lọ lóru tíyàn bá ti pé ọmọ 45 ọmọ 50, bọ̀ ilé tó dáa jù tí yóò bá ní family history òun ni pé láti di èjì àádọ́ta ọdún kí wọ́n bẹ̀rẹ̀ sí ní ṣe àyẹ̀wò nípa ẹ̀. So tíyàn bá ti wá ń rí i pé ókè o mo délé ìtọ̀ jáde bọ̀rọ̀, èèyàn wá ń dúró, èèyàn ń gbèdì, èèyàn ń ga, èèyàn ń kúrú, kí èèyàn ti mọ̀ pé wàhálà kan ti ń ṣẹlẹ̀. Àbí èèyàn ń tọ̀ lọ ó wá ń bẹ̀rẹ̀ sí ní dákú, ó ń dá kó tó di pé èèyàn tọ̀ tán yẹn ó dá bí mẹ́rin sí márùn-ún, kí èèyàn ti mọ̀ pé nǹkan kò lọ déédé. Àbí èèyàn tọ̀ tán, èèyàn tún wá lọ jókòó, èèyàn tún wá rí i pé ìtọ̀ yóò tán bẹ́ẹ̀, èèyàn tún padà lọ láti lọ tọ̀ lẹ́lẹ́kejì, kí èèyàn ti mọ̀ pé nǹkan kan ṣẹlẹ̀. Àbí èèyàn tọ̀ tán kò dáa kọ́mọkùnrin, ẹ máa rọ́ ọmọkùnrin míì tó bá ń tọ̀ á máa gbọ́n pé kó máa ṣèkẹ̀ pé kó lè stop, kó lè dá, kò ní dá, kí èèyàn ti mọ̀ pé nǹkan kan ṣẹlẹ̀ nípa ọ̀nà ilé ìtọ̀ yẹn tó jẹ́ pé ó lè jẹ́ prostate yẹn ló fà á. So èyí yóò wọ ẹ̀ bàjẹ́ gbogbo ẹ lè ṣẹlẹ̀ lẹ́ẹ̀kan náà, ó lè jẹ́ ọ̀kan ló máa ṣẹlẹ̀. So ìdí nìyẹn tó jẹ́ pé ó ṣe pàtàkì pé kí èèyàn gbìyànjú láti ṣèwádìí síwájú sí pé ṣé kò ṣe pé èèyàn ti ní prostate. Eléyìí tó wá ṣe tí ó tà fẹ́ kó lọ síbẹ̀ òun náà ni pé tó bá ti wá lọ sáàyè pé ó ti kọjá sí ibòmíì lára, àwọn kan tí èèyàn lè rí bí pé kí èèyàn máa rù, kí oúnjẹ má wù yàn jẹ, kí ó máa rẹ̀ yàn gbogbo ìgbà, kí eegun máa dùn yàn, eegun ẹ̀yìn eléyìí tó common jù nìyẹn, eegun ẹ̀yìn kó máa dùn yàn. Àbí kó jẹ́ pé ẹsẹ̀ yẹn èèyàn ti lè rìn jáfáfá tẹ́lẹ̀, èèyàn lè rìn jáfáfá bíi tẹ́lẹ̀ mọ́, èèyàn ti mọ̀ pé ẹsẹ̀ yẹn ó ti fẹ́ máa weak díẹ̀díẹ̀. So irú àwọn nǹkan báyìí lèèyàn máa rí tó wáyé pé ó ti bọ́ sí àyè ibòmíì tá a jẹ́ pé a fẹ́ kó ṣẹlẹ̀, nítorí pé eléyìí tó dáa jù òun ni pé kó má tí ì lọ síbòmíì nígbà tá a bá mú. Ṣùgbọ́n tó bá lọ síbòmíì náà ni nǹkan nípa ti prostate cancer tó fi yàtọ̀ sí tẹ́lẹ̀ táwọn cancer míì ni pé ó ṣe é tọ́jú, tó yẹ pé kí wọ́n sì wá sí hospital ó ṣe é tọ́jú dáadáa.
Ẹ ṣeun gan ni dókítà Bakare kó àtúntúnú látẹ̀kan. Ẹ já lọ síde Gẹ̀ẹ́sì. Doctor, there are lots of myths and fables about the causes of prostate cancer, such as not having adequate sexual contact. Can you please help speak to some of these myths and tell us true causes of prostate cancer? I did mention it in my introduction where this has caused a lot of problems among couples, and maybe we have a very active couple and the other party is not active. Especially most times men are usually more active than women, and the men get to tell you that, oh, if you cannot do this, let me have as many wives as much as I can because I don't want to have prostate in future. I want you to clarify all of these myths and fables.
Yeah, thank you very much. Actually, concerning sexual intercourse and prostate cancer, what I would just say generally is that we should not look at it specifically for prostate cancer in terms of sexual intercourse. It is generally known that sexual intercourse is good for the body. Mentally, physically, socially, relation-wise among the couples, because of the things that are released to the body, cardiovascular importance, immunological importance, and some other importance that you derive from sexual intercourse. That is why it's encouraged for couples to have it as in often, because it's good for the body. Now, for the prostate cancer, just specifically because of what is going around concerning it, I would just say that studies that were done on it, there are studies that were carried out concerning the frequency of ejaculation. It has to do with the ejaculation now. Frequency of ejaculation. Does it confer any risk for prostate cancer? Does it increase the risk or reduce the risk? To cut it short, it's confirmed that, I don't want to use the confirm, it's an association because they are looking at it from overall, it was a prospective study. They look for over 18 years. They look at some men, I think more than 3,000 men were followed up for 18 years. And they found out that people that had sexual intercourse, ejaculation, I'm using the word ejaculation.
Okay.
Ejaculation more than 21 times, that they have reduced risk for low-risk prostate cancer. For low-risk prostate cancer overall now, reduced risk for low-risk prostate cancer. So this is telling us that, as we will say of sexual intercourse, it confers advantage too. So they explain whether it's for prostate test, flushing out all the oxidative substances in the prostate. But there is another study that also says that not having sexual intercourse does not increase the risk of prostate cancer. I just want us to understand. So because if it's that having sexual intercourse will reduce the risk, it's okay. But the people that maybe religious wise or based on their belief, they don't engage in sexual intercourse, they don't have increased risk. So this is telling us that it is still a general thing about sexual intercourse, the importance, the way exercise, what it will do to our body, and other things like that, good diet, exercise, and some other things like that. We shouldn't now put so much stress, this is my own thought now, on sexual intercourse, if it's going to prevent prostate cancer, forgetting those important things we have to work upon so that to checkmate the menace of prostate cancer in our environment. It's good generally, sexual intercourse. Studies have shown that, of course, it does confer advantage. So which couples should be encouraged to engage more in sexual intercourse, couples now, because there is a study that says that it's also partner-based. Yes, because promiscuity sometimes predisposed to infection. It has been confirmed that chlamydia, gonorrhea, human papillomavirus increases the risk of prostate cancer.
Wow. So having multiple sexual partners can also increase the rate of prostate cancer.
Yes.
Thank you very much, doctor. We got that. And then you also mentioned that if you don't do your exercises, so this is down to all men out there, whether you are in your 20s and you are living extra, any kind of lifestyle, you're in your 40s, you're in your 50s, saying, oh, in the future, by the time I get 60, I don't want to have prostate, and you start engaging in different, activities. This is to tell you that you are likely, to still have what you are running away from. And then it also shows that whether you are having it or not, whether you are married or you are not married, make sure you do exercises. So for reverend fathers, for instance, reverend sisters, in the Lord, for instance, and they don't engage in all of this, it means that once they go through regular body exercises, they won't have to, experience any of this, especially the men, the reverend fathers. Exactly. So this is to you two out there. So whether you are, some persons will call themselves celibate and all that, you don't do all of those things. Whether you are a reverend brother, reverend father, because as we have reverend brothers too, they are not up to the fatherly age. Please do exercises regularly. Don't make this issue, don't make a mountain out of this molehill issue. Doctor has clarified it a whole lot. Thank you very much, doctor. So we'll move on to another question just before we open the phone lines. Remember, we're live on Facebook at Glow 99.1 FM Akure. You can watch us live on Facebook. And you may listen to us on our website, www.glowfmradio.com. Doctor, very quickly, just before we go on a short break now, I would like you to please tell us, because there are so many stories on social media on how men can prevent themselves from having this condition, such as, eating garlic and the likes. How true are these stories? Scientifically, what are the measures that men are expected to take to prevent themselves from coming down with prostate cancer?
Yeah, thank you very much. Concerning some of those things that are being pushed over the internet, I would say that some of these things, they are still under research.
Okay.
One cannot categorically say that it's only whatever comes from the scientific world that only work. No, but we need more research on these things. The anti-malaria we use nowadays was discovered in China from the through native means. You understand? So one cannot rule out some of these things, but what is confirmed today is still the best form of treatment that is supposed to be stick to.
Okay. Because
this has been tested and confirmed by scientific word. Because some of these things, we don't have research on some of these things like that yet that has been confirmed. So I would just advise people is, what has been confirmed should be stick to. Why we be careful of using things that you don't even know the dosage. And most times these things, they are supplements, they are not really drugs. And you cannot put supplement in position of drug. So it will not work as drug. They can only support the body. Why the the drug has been confirmed to work for those things. So that's what I will advise for the second part of the question. I didn't
I said, how throughout this story, scientifically, what are the
Okay,
measures
yeah,
now?
yeah,
Scientifically, what are the measures that men are
yeah,
expected to
yeah.
take, to prevent themselves from coming down with prostate cancer?
Thank you very much. The measures, we've mentioned some of them, but specifically now, from the age of 50, 45 or 50, whichever the case is, one should start screening for prostate cancer. And for now, the best form of screening is to look out for these symptoms we have talked about. Secondly, there's what we call PSA. The meaning is prostate specific antigen. At least from the age of 50 years, from the age of 50 years, one should do it yearly, at least once in a year. PSA. Just walk into any standard laboratory, you can do it by yourself. Say you want to do your PSA. So once it is less than 4 for African, we use 4, 0 to 4 as normal. When it is less than 4, we usually categorize it as normal. But mind you, the one you did first, it matters. If you do it this year and it is, let's say 0.5, and you are doing it the next year, it has jumped to 3, you should be concerned. So don't say it's still less than 4, I'm okay. No. That rate of jump, that's what we call the velocity, is too high. So one should be concerned, one should see a specialist for that. So we use PSA. Then if you can visit a urologist, that would be nice, or a specialist that can do what we call digital rectal examination. The specialist will examine you the prostate and feel the prostate, and this is another way. Then ultrasound, one can done by a specialist that can look at the prostate to compare, to look at it for fissures that can look suspicious in the ultrasound, prostate ultrasound. These are non-invasive things that can be done. So religious body do organize outreach to do all these things. One should engage in these things at least yearly. These are things that can be done. Looking out for the symptoms, do PSA, ultrasound examination, we call it GRE. Then one can do ultrasound. So in standard society, these are things that are being organized, that when you reach certain age, they make sure that you do all these things.
Thank you very much, Dr. Bakare. Ká tó ṣojú òpó lẹ́ ní bí ìṣẹ́jú kan, mo fẹ́ kẹ́ ẹ sọ àwọn nǹkan tí pàápàá jùlọ àwọn.
Sọ fáwọn èèyàn wa ni pé tó bá fẹ́ jẹ irú àwọn nǹkan wọ̀nyí, jẹ́ kí dókítà tó mọ̀ nípa ẹ̀ kó sì máa rí ẹ̀. Wọ́n á lè advice èèyàn, because ìgbà míì wà tó jẹ́ pé àwọn nǹkan wọ̀nyí ó máa ń ṣe àkóbá fún ara. Irú àpèjúwe ń ṣe ẹni tó ń sọ pé kó má jẹ nǹkan míì mọ́ ju ẹ̀wà WhatsApp lọ. Ara dẹ̀ bùkátà sí at least 60% carbohydrate, 20% protein. Ó ti ní bó ṣe yẹ kó jẹ́ lójúmọ́ téèyàn gbọ́dọ̀ jẹ ká tó fi ń pè ní balance diet. Ẹlòmíì àti wá jẹ ẹ̀wà WhatsApp fóṣù kan, gbogbo ilé ayé àti fẹ́ di rádaràda. Látara pé kò gba ìmọ̀ràn lọ́dọ̀ àwọn èèyàn tó wọ́n mọ̀ nípa kínní. So ilé ló fi ń dáa jù pé fi gbogbo ẹnu bu ẹnu àtẹ́lù pé àwọn kínní ò kì í ṣiṣẹ́. Ìwádìí sì ń lọ síwájú. Ìgbà kan wà tó jẹ́ pé malaria máa ń pààyàn bí ṣeré-ṣeré ni. Ṣèbí malaria ló di nǹkan téèyàn wọlé sí ilé pharmacy téèyàn rògùn sí téèyàn tọ́jú ẹ̀. Nígbà kan dẹ̀ ní bí cancer lòun náà rí. So ìmọ̀ ń tẹ̀síwájú, ó lè dọ̀la ń sìn kan tó rògùn kan tó jẹ́ pé wọ́n kàn lọ gba oní prostate cancer ẹ̀yà lọ́ra ń bẹ̀ yẹn kó tètè lò. Ìmọ̀ lè débẹ̀. But nǹkan tá à ń sọ ni pé ibi tí mò ń wà lénìí, ó ní pé ó ti ṣe é cure, ó ti ṣe é tọ́jú dáadáa tó bá ti lọ síbòmíì lára. So ó pàtàkì pé ká má kàn máa lo oríṣiríṣi nǹkan tó bá ti ń sọ lórí íńtánẹ́ẹ̀tì. Ìgbà míì wọ́n á lo AI láti gbé picture olórí orílẹ̀-èdè àná Olúṣẹ́gun Ọbásanjọ́, wọ́n lòun ló sọ pé ògùn yìí dáa. AI náà dẹ̀ fi ṣe, wọ́n lo ti Ọ̀ṣínbàjò.
Kódà gan ti ń fi AI sí ohun èèyàn gan, wọ́n á ní kó lo ohun ẹni báyìí, á dẹ̀ lo ohun ẹni yẹn.
Exactly. So ìdí nìyẹn tó yẹ pé èèyàn bùkátà sí kéèyàn ní specialist tó yẹ pé a máa báyàn sọ̀rọ̀ nípa àwọn kínní tí èèyàn máa béèrè àmọ̀ràn lọ́wọ́ ẹ̀. So àwọn nǹkan wọ̀nyí kéèyàn ṣọ́ra fún, kéèyàn tẹ̀lé ilé tó jójúlówó nǹkan tó ti fìdí ẹ̀ múlẹ̀ pé òun náà fi ń treat ẹ̀. Ẹlẹ́kejì wa ni pé kí làwọn kan tá a lè máa ṣe tó pé a fẹ́ fi tètè mọ̀ pé kínní ká máa fi ṣe àyẹ̀wò.
Dókítà ọ̀kẹ́ tó dárúkọ nǹkan lẹ́ẹ̀kejì yẹn jẹ́ aṣojú òkòdè, so a máa ṣe síra báwọn èèyàn ṣe ń pè wọlé, kẹ́yìn náà máa fún wa ní ìdáhùn kẹ́sì máa bá wa yànnàná ọ̀rọ̀ yìí. Àwọn nọ́mbà tẹlẹpẹ náà ni 0805-551-1110, 0805-551-1110 or 0706-677-1822. Those are the two numbers to call to be part of the conversation this morning. Numbers méjì yẹn náà ni ẹ lè pè láti darapọ̀ bọ̀ wá bí jẹ́de guest level fi bèrè ní o tàbí èdè abínibí wa pe nọ́mbà wọ̀nyẹn àlejò wa wọ́n á dẹ̀ bá yín dáhùn sí àwọn ìbéèrè tẹ́ bá ní nílé. Dókítà fẹ́ dárúkọ nǹkejì tí ó yẹ káwọn èèyàn ṣe àwọn ọkùnrin ṣe.
ẹ ṣe gan ni olóòtú. So alákọ̀ọ́kọ́ ilé tí màá sọ òun náà ni ká bẹ̀rẹ̀ láti pé kéèyàn fojú sílẹ̀ fún àwọn nǹkan tá a ti dárúkọ lẹ́ẹ̀kan nípa àwọn bí nǹkan tá a máa rí nípa ìtọ̀. Èèyàn tọ̀ dáadáa, èèyàn jítọ̀ lóru, èèyàn ìtọ̀ jáde bó ṣe yẹ kó jáde, èèyàn tọ̀ tán, èèyàn sì ń rò pé ìtọ̀ yóò jáde tán. So àtàwọn orú bẹ́ẹ̀ tí eegun bá ń dùnyàn tó ń rẹ̀yàn tí èèyàn lè rìn dáadáa mọ́ tí ẹ pé ẹ̀yìn dùnyàn tó dẹ̀ jẹ́ pé ó ti wá di lemọ́lemọ́ kéèyàn gbìyànjú láti rí àwọn dókítà. Ẹlẹ́ẹ̀kejì, àyẹ̀wò wà tó jẹ́ pé èèyàn máa ń ṣe láti bí tí èèyàn bá ti pọ́ ọmọ 50 àbò pé ọmọ 40 ó lé 5 kí tó yẹ pé èèyàn máa ṣe tó yẹ pé láti ti fètè mọ̀ pé tí kinní bá ti lọ sókè o nǹkan kan tí kò ṣe pé prostate ti ń dé. Alákọ̀ọ́kọ́ ẹ̀ náà ni pé nǹkan náà mọ̀ sí PSA, ìtumọ̀ rẹ̀ ní prostate specific antigen. So àyẹ̀wò yìí.
ẹnìkan pè wá dókítà jẹ́ hello ẹ káàárọ̀.
Ẹ káàárọ̀ mà.
Ẹ káàárọ̀ sà, kí lorúkọ yín bolẹ́ tí ń pè wá?
Wọ́n pè láti Àkúrẹ́, Emmanuel lórúkọ.
Ó dá ọ̀gá Emmanuel dókítà ń gbọ́ yín o.
Ẹ ṣe ẹkúṣẹ́ dókítà ẹkúṣẹ́ o.
ẹ ṣeun sir.
Ẹjọ́ tá mo fẹ́ kí ni permanent solution? Ṣé surgery wà òkè àbí injection wà náà tó apart from surgery lẹ́yìn ojú lè lò? Àbí injection lè gbà lẹ́yìn.
Dókítà ti gbọ́ yín bẹ́yìn a sì máa débẹ̀ ẹ ṣeun gan ni dókítà mo lérò pé ẹ gbọ́ nǹkan tí wọ́n sọ ìyẹn náà ni àwọn nǹkan tá a fẹ́ béèrè next lẹ́yìn ilé àmọ́ wọ́n ti ṣáájú béèrè so but kó tó di pé ẹ dáhùn ṣé wàá kọ́kọ́ dáhùn ìbéèrè wọ̀nyí àbí tá a bá ti débẹ̀.
ẹ jẹ́ kí n kàn ṣàlàyé ilé tí mo bá lọ sódà tá a
ok ẹ dà.
so tá a bá ti àyẹ̀wò ẹ̀jẹ̀ yìí tá a mọ̀ sí PSA yìí ìwọ̀n rẹ̀ ni pé láti 0 to 4 ní normal but mo ṣàlàyé pé tí wọ́n bá ń ṣe lọ́dọọdún ó dáa kí wọ́n máa ṣe lọ́dọọdún so tí wọ́n bá ṣe tọdún yìí tó yẹ kó wà níbi 0.5 tí wọ́n bá ṣe tọdún tó tẹ̀lé tó wá ti lọ sí 3 kí wọ́n máa sọ pé torí pé ó sì less than 4 pé mi ò ní ṣe nǹkan kan kí wọ́n lọ bá dókítà kí ló fà á tó fi jump láti 0.5 sí 3 so wọ́n bá yẹn ṣèwádìí.
alẹ́ nìkan hello ẹ káàárọ̀ ẹ káàárọ̀ kí lorúkọ yín bolẹ́ tí ń pè wá. ẹni Adémọ́lá láìní ń break àgbọ́yìn dáadáa o. hello ó dà bí a kún wá pè wá padà.
àyẹ̀wò yìí so PSA là ń pè káyọ̀ kí wọ́n máa ṣe lọ́dọọdún. ẹlẹ́ẹ̀kejì ni pé a lè ṣe ìgbàláyé wà kárí dókítà kan bá wa yẹ prostate yìí wò tó má ti bá wa fọwọ́ sí òun láfi sọ pé prostate yìí ó dáa kí wọ́n ṣe àyẹ̀wò síwájú lórí ẹ̀ ó ti ń tóbi o ó ti ní nǹkan báyìí o kàn bá wa yẹ̀ wò. ẹlẹ́ẹ̀kẹta a lè ṣe scan àwọn tó bá mọ̀ nípa ẹ̀ dáadáa wọ́n bá wa wo prostate yẹn pé ok prostate yìí ṣé ó ṣì wà ok ṣé kò tí ì tóbi jù ṣé kò tí ì bẹ̀ sí ní dé ojú ọ̀nà ilé ìtọ̀ because ìgbà míì ó lè tóbi nígbà míì tó yẹ pé á lọ ṣàkóbá fún kidney méjèèjì àwọn èèyàn kì í mọ̀ yẹn torí pé ó ń blọọkì páìpù ìtọ̀ so kò ní jẹ́ kí ìtọ̀ jáde á máa dá ìtọ̀ yẹn padà sára kidney so gbogbo kan wọ̀nyí ni àyẹ̀wò scan lè bá wa gbé jáde. So ẹlẹ́kẹrin ni pé àwọn ètò kí mo ṣe sọ medical tree tó yẹ pé a lè lọ síbẹ̀ tó yẹ pé wọ́n lè bá wa máa ṣe irú àwọn nǹkan báyìí tó yẹ pé lọ́dọọdún so tó fi ṣe pàtàkì.
ẹ ṣeun gan ni hello.
hello ṣẹ́gun báyìí.
ẹ káàárọ̀ ń gbọ́ yín báyìí.
ọ̀rọ̀ dá fún yín mo kí adẹ̀kí dókítà wa.
ẹ ṣeun gan.
àgbà tó tónu látàárọ̀.
ẹ ṣeun gan.
ọgbọ́n ò ní kó mọ́ yín lórí. nígbà tí dókítà wa ń sọ̀rọ̀ tẹ́ ń béèrè lọ́wọ́ wọn ní wípé káńsà ìyẹ̀wò táwọn ibi tó tọ́ àwọn ìpèníjà táwọn èèyàn ní ni wípé báwo la ṣe fẹ́ mọ ibi tó tọ́ because ordinarily ìjọba ló yẹ kó pèsè ilé ìwòsàn fún wa àwọn ilé ìwòsàn wọ́n yẹ débẹ̀ ẹ wà confuse ẹ̀ ṣe ní ẹ mọ ibi tẹ́ máa yà sí wọn ò ní rí dókítà rí nígbà tẹ́ bá sọ pé ká lọ síbi tó tọ́ báwo la ṣe fẹ́ mọ ilé ìwòsàn tó tọ́ báwo la ṣe fẹ́ rí dókítà tó tọ́ kí ni cost of àwọn my main another problem ni pé I believe àwọn èèyàn ni pé hospital wà too expensive báwo la ṣe fẹ́ amend gbogbo nǹkan tẹ́ tí mo béèrè ẹ̀kọ́ ètò.
ẹ ṣeun gan ni dókítà ẹ ti gbọ́ yẹn sáré ṣàlàyé ẹ̀.
so kí n ìbéèrè alákọ̀ọ́kọ́ tí wọ́n béèrè lẹ́ẹ̀kan.
wọ́n ní ṣé wà treatable òun náà ni bóyá kí n kúkú béèrè ní papọ̀ mọ́ èyí tí mo fẹ́ béèrè torí ìbéèrè yẹn wà lára ìbéèrè yìí. Doctor, I would like to ask you, is prostate cancer treatable condition, and are the treatment modalities available locally and also affordable? Ṣé rí i pé ìbéèrè wọn gan méjèèjì ẹyẹ kan ni ìtawà ní níbí. Dókítà mo fẹ́ kẹ́ ẹ jẹ́ gbé pé iná ká wọn tí wọ́n fẹ́ béèrè lọ́wọ́ yín. Hello, ẹ káàárọ̀. Hello. Ẹ káàárọ̀ o. Ó dáa máa sọ ohun tẹ́ a gbọ́ yín dáadáa bóyá ẹ lè pè wá padà. Ẹ já wo bóyá lè ó dáa wọ́n ti pa lọ́kè lọ́hùn. Ẹ pè wá padà tẹ́ bá ní àǹfààní. Àkókò tí ń pò wá ní kọ́pọ̀ mọ́ra o. Hello. Hello. Hello, ẹ káàárọ̀. Yes, sir. Kí lorúkọ yín bọ́lẹ̀ tí ń pò ẹ ṣe ní kánmọ́kánmọ́? Victor. Ó dáa, à ń gbọ́ yín. We can barely hear you. The network is not so good.
Hello.
Yes, hello.
Doctor talk about ejaculation.
Yes.
And I want to ask, how many how many times should ejaculate a week? That it can reduce the factors of having the prostate cancer.
Thank you very much. Doctor, you just heard that. They said how many times can. That's how much we can take. We are sorry. Oh, the calls are coming in now. Let's okay. Hello, good morning. Good morning. What's your name? Okay, please go ahead with your question.
We talking about prostate cancer. What about breast cancer? If he has spread, all these fans that don't pass it.
Thank you. But we're talking about prostrate today for the men folk today. Maybe we'll bring. We've talked about this before, but we might actually, look at it one of these days. But until then, this is just about men today. Prostrate cancer. Thank you very much for calling. Of course, we have treatable. There is no disease recently based on the research that medical doctors have done that are not treatable. But we'll talk about that more extensively on days when we have that particular topic. So, doctor, you have the floor. We just have about 1 minute before we round off.
Yeah, thank you.
Everything, is it treatable? Is it affordable? Just in very short sentences.
As I said, prostate cancer is curable, it's treatable, and also manageable when they are advanced. So we have variety of treatment that when it is diagnosed, we want to categorize the patient. Is it localized? Is it advanced? If it is localized, that means we categorize under curable. So if it is advanced, we say, okay,
manageable.
Palliative. We call it palliative treatment.
Okay.
So depending on both, prostate cancer, as I said, is not necessarily
a death sentence.
Yes, it's a very treatable disease, though it can be aggressive, especially for those who are having it at the age of 40, 45.
Or even 70.
Early. It can be aggressive sometimes, but majority, they are not aggressive. Okay. Majority of prostate cancer. So it's manageable. Okay. So we have cure, we have different forms of treatment.
Are the treatments affordable? You did mention that part.
Affordability, I think I will mention this, that it's NHIS should be something people should explore.
Okay.
Yes.
Does the NHIS cover prostate cancer treatment?
It has been extended now.
Okay, thank you very much, Doctor, for coming on the program. We just have to say bye-bye now. Our time is fast spent. Many thanks to consultant urologist for the medical center, or Dr. Bakare Nurudeem. Thank you so much for coming on the program this morning.
Thank you very much.
Yeah. All right, on that note, we draw the curtains on today's edition of Glow Health Talk with Nigerian Medical Association Ondo State Chapter. This program is co-sponsored by NMA Ondo Chapter. I'd like to say a very big thank you to the executive producer of the program, Dr. Ezekiel Akon, and to our producer, Dr. Okpeyemi Komolafe. My name is Comfort Omolafe. Take good care of your health. Bye.